Hello guys, welcome to Bio class. In last session, we have discussed about the definition of health. We discussed about definition of diseases, and we know that there are the three types in the diseases. One is communicable disease, non-communicable disease, and it's a genetical disease, or we also calling as a congenital. Okay, so in this session we're going to be focusing on the common diseases in humans. Okay, so as we know that there are number of microorganisms are there. Yes, there are more numbers of microorganisms are there, and they may cause disease in the humans. Okay, so like bacteria, viruses, fungi, protozoan, helminthes, etc. Right, so these are all our variety of organisms, and they are responsible for causing the disease in the humans. Okay, so next definition, pathogens. Okay, yes, so what is a pathogen? Means disease causing organism are called pathogens. Okay, the organism which causes disease, those organisms we are calling as a pathogens, or the organism has the ability to cause the disease is called pathogens. Okay, yes, we call as pathogen. These pathogens means nothing but these are disease causing organisms. Okay, yes, so most of the parasites are pathogens. Okay, so almost the parasites are there, they are the pathogens, means they are disease causing organisms. Yes, they may found inside the body or they may found the outside the body. Okay, now how these pathogens enter into the humans means it enters through the various modes or it various means. After that, entering into the body, it will get multiply and it will the interfere or it will disturb the normal vital activity of the, it may be tissue, it may be organs or organ systems. Okay, so because of this what happens, so there is a morphological and functionings will be get damage. Okay, yes, as we know that there are number of organisms are there, most of parasites are considered as pathogens. How they are going to enter into our body? It may be enter into various modes. It may enter into our body through the nose, it may enter through the mouth, from the skins, right? So there are different modes will be there, or it may be by the food or maybe by the water. Okay, so different modes the pathogens will be enter into our body. So after entering into our body, it will get multiply and it will disturb the normal activity of the tissues, organs or organ systems. Okay, yes, after that, entering inside the body, so most of the pathogens, yes, they are going to be adopt with the, yes, inside of the host body. Okay, after entering, so which should be get adjust or it should be get adopted to the, yes, host body. For example, if you take a pathogens, the pathogens which are found in the intestine, yes, yes, they have to be adopted and they have to be survive in the stomach at low pH, and it should be shows resistance to various digestive enzyme. Okay, it means, so most of the pathogens entering into our body, so obviously they will go for the multiplications and it will disturb the, okay, it will disturb the our humans normal activity. Okay, before that they have to be face, or they have to be face our body. Okay, and our body has a immune system. Okay, there are a lot of barrier systems will be there, so uh, it should be come over all these difficulties. Okay, so this difficult come over difficulties, all the things we are considering as it is a adaptations of the pathogens. Okay, in last slide we discussed that, so there are so many organisms are there and they are responsible for the causing disease in the humans. So in this slide we'll focus the disease caused by the bacteria, those we are calling as a bacterial disease. We'll discuss one by one. So we are given here like typhoid, pneumonia, diphtheria. So these are diseases we are listed. So we will discuss one by one. First one, it is a typhoid. We are also calling as enteric fever. Okay. So typhoid, the causative organism is the typhoid disease is caused by Salmonella typhi. It is caused by the bacteria, that bacteria we are calling as a Salmonella typhi. Okay, now which part will be get infected or which part will be get damaged means it is a intestine, right? So causative organism is Salmonella typhi. So site of infection, or it is a the way which part will get damaged here. So it is a small intestine. Now mode of infection or mode of transmission, how it is going to be entered to the our body. So especially it is from the contaminated food and water. If you eat or if you drink the contaminated food and water, so from that it will enters to the our body. Okay, so next one headline is it is a symptoms. Okay, so what are the symptoms? Yes, first one, high fever. The temperature is going to be rise, so that is what we are calling as high fever. Weakness. Okay, so there will be the weakness. If you're suffering from typhoid means it will shows the high fever, weakness, stomach pain and loss of appetite. So loss of appetite. Okay, so there is no hungriness, that is mentioned as loss of appetite. Constipations. Okay, so there is no proper bowel movement, so that is what calling as constipation. And headache. Okay, so headache and intestinal perforation. Now what is the meaning of perforation? Means there is a formation of small pores in the intestine, that is what calling as a intestinal perforation. Okay, if you neglect this, all this is symptoms. Okay, if you neglect the initial condition of typhoid, so later what happens, it may be heavily damaged to the intestine and the patients may go for the death in case of severe cases. If you neglect early, so when it reaches to the severe condition, so may lose the patient or the patient may get dead. Okay, yes, in last slide, so we discuss about the symptoms, causative organisms of typhoid. So in this slide we'll focus on preventive measures and control measures of typhoid. Okay, first point, providing proper community sanitizations. Okay, so in our surrounding area, in surrounding colonies, okay, they should not be get open drainage system, so everything would be get closed, and if there they have to be take for the proper sanitization. Yes, second one is we have to drink the pure water, or no, we have to drink the purified water. Next one is it is a providing hygiene food free from the flies. Okay, whenever we are eating from the roadside food, okay, we have to ensure that the food will be the hygiene and good. It should be closed in the proper manner. So next one is, so typhoid vaccines are available. So if you take the vaccines, so we can prevent this typhoid diseases. Next one is if you are suffering from the typhoid, when you go for the, yes, we have to go for the medicines. So like antibiotics, if you take antibiotics, so almost it will cure the typhoid diseases, but under the prescriptions of, yes, doctors. Okay, then typhoid disease, it is confirmed by one of the tests, and that test we are calling as a Vidal test, or we are also calling as a Vidal test. Yes, we will discuss about typhoid. So next one is it is a pneumonia. Okay, so pneumonia, it can be caused by different bacterial species like Streptococcus pneumonia, Diplococcus pneumonia, influenza. So any of these can cause the disease, that is a pneumonia in humans. Okay, we'll discuss about pneumonia disease. Okay, So the pneumonia disease, it is related to the uh, damage, or it is infection related to the lungs. So it is caused by different bacteria, so like streptococcus pneumonia, okay, H influenzas. So there are different bacteria which are responsible for causing the pneumonia. Now, how the pneumonia will be get entered to our body means it will enter to our body by the inhalation of contaminated droplets. Okay, so pneumonia patient. So pneumonia patient, when the expel their sputums, infected sputum from, it will spread into the environment. So when you inhale that contaminated air or air droplets, it will enter to the our body. Next one is symptoms. Okay, symptoms is the patient suffering from the pneumonia, they will show the symptoms is like high fever, chills, there will be a persistent dry cough. Now what is the meaning of persistent means? Continuously, okay, continuously dry cough and chest pains. Okay, there will be the chest pain. Next, so alveolar it will get filled with the fluid and it will cause to severe respiration problems. Okay, so later what happens, the alveolar may get filled with the fluids, and because of that what happens, it may leads to severe respiration problems. So one more symptoms, so severe cases like cyanosis, so the lips and fingernails are become, yes, they are become bluish in color. The color will be changes from gray to bluish. When it is happens, when you neglect, when you ignore in the early condition, so later it will become the severe. Okay, so next we'll focus on prevention and control measures for pneumonia. Okay, so first point, it is we have to use the mask. Okay, and we have to wash our hands properly with soap and hand sanitizers. Okay, so sometimes what happens, so when you get exposed to the patient directly, so it will that droplet may inhale to the inhale by the healthy person, so it will get entered to the healthy person, there will be chances. So one more chances why we have to wash our hand means, whenever touch the some materials or some things, so it may be that droplets may be fallen than that, so it will comes to the our body. For that we have to be wash our hands with soap and sanitizers. Okay, so then we have to take the proper medications under the guidance of doctors. Yes, we have to go for the eat right, plenty of fruits, we have to take good food and plenty of fruits. Next one is stay away from the sick people. If you found that the person is suffering from pneumonia, yes, we have to try to maintain the distances. Okay, and last one is vaccinations. Okay, we have to go for the vaccination, right? So this is all about the pneumonia. So what are things we discussed? We discussed about mode of transmission. We have focused on symptoms and its prevention and control measures. Okay, so we'll discuss one more disease, that is a diphtheria. So diphtheria is caused by Corynebacterium diphtheria. So which organ is going to, again it is our respiratory system, so lungs. Okay, so how is going to enter to our body? So it is entered to our body by the inhalation of contaminated air droplets or aerosols. Okay, so this pathogen, after entering into our respiratory system, it will produce a certain kind of toxin, and that toxin, it will destroy the tissues. Okay, so the patients suffering from the diphtheria, so will show some symptoms. Okay, so what are the symptoms means? Chills, fatigue, fever. So fatigue means it is we can call as a weakness, tiredness. Okay, Next, noisy breathing. Okay, the patients who are suffering from diphtheria, they are showing the noisy breathing. Whenever they will breathe, yes, they are making some kind of noise or some kind of sound. That is what we are calling as a noisy breathing or shortness of breath. Yes, there will be screen rashes, and the patients may be feeling the difficulty in the swallowing. Okay, so these are the symptoms. So next one is, it is a prevention and control measures. Okay, so we have to avoid the direct exposures with the patients. We have to use the mask. Okay, so there will be the one of the vaccine for diphtheria, that is we're calling as DPT vaccines, right? So we discuss about diphtheria. We know that it's caused by Corynebacterium diphtheria. How it is going to enter? It will by the inhalation of contaminated air droplets. So what are symptoms? Symptoms is like chills, fatigue, fever, breathing problems. Noisy breathing means when you breathe it will making a sound. Okay, difficult in swallowing. Okay, so control measures and prevention is, so we have to wear the mask, avoid the direct contact exposures to the with the patients, and there will be the vaccine, and that vaccines we are calling as a DPT